I'm wanting to modulate people's immune system first, like I said. So most of my patients have mast cell activation syndrome. So I'm using KPV and Amlexinox to modulate mast cells. I'm usually bringing ketotifen on board. Of course, it's not a peptide, but it helps a lot with mast cell activation syndrome, low dose naltrexone. And I'm also using BPC 157, good old BPC. It's like it's my favorite peptide. It brings inflammation down in the gut and everywhere. Or if you inject it in areas of pain, it brings pain down. A lot of my patients have cranial cervical instability, whether it's mild, moderate, or severe. BPC 157 cream applied to the back of the neck can really help with that, or BPC 157 injected just subcutaneously or in the muscles intramuscularly can really help a lot with pain. And what else do I love for peptides? TB4 frag. So usually I'm using the peptides to calm down the immune system first, and then I might start to use other ones to start to kill infections when the time is right. Thymosin alpha is a good one. LL37. Those are my go-tos for when the time is right. For sleep, our patients have a lot of sleep issues. I like to use a combination of delta sleep-inducing peptide and epithalon along with thymosin. That trio really, really helps people with sleep. A lot of times our patients, they're not able to have intimacy with their partners because they're so sick. PT141 helps a lot with that. You can give them a little bit of kisspeptin, a little bit of oxytocin with that. That's going to help with their sex lives, which is so important to them. And then for the neurotropics, I like to use CMAX and CLANC. So CMAX is going to help with brain inflammation. So will RG3. That's not it's not a peptide, but it works a lot like one. And then CLANC to help with memory. But what I've noticed with the neurotropics is that the inhaled ones, right? They're not going to work very well when the patient has infections in the sinuses. So usually I'm dealing with those infections first, and then I'll give them the inhaled peptides. And that's when I start to see them working